Bladder cancer can be difficult to find in its early stages. Early detection is very important for successful treatment. Many people do not notice the first signs, or these signs are mistaken for other health issues. This delay makes fighting cancer harder. We really need to understand these early detection problems, because this will help us improve care for all patients. It is a serious condition that needs our attention. The most common signal of bladder trouble is blood in the urine. Doctors call this hematuria. Sometimes you can see it. The urine may look pink or red. Other times, only a microscope can find the blood cells. This might happen during a routine urine test. Hematuria can have many causes, like a simple infection. However, it should never be ignored by patients. It is a key warning sign to see your doctor. When a patient has hematuria, doctors have guidelines to follow. These guidelines help them check thoroughly for serious issues. This includes checking for bladder cancer. But studies show these best practices are not always used. This can lead to missed chances for an early diagnosis. Sadly, this problem affects some groups of patients more than others. This creates unfair differences in healthcare quality. Women and Black Americans often face these early hurdles. Doctors might be slower to think of bladder cancer in women. They might blame symptoms like hematuria on common urinary tract infections, or they may link it to gynecological problems. Similarly, Black patients may not always get the same level of quick investigation. These early differences in care can lead to longer diagnostic journeys. This sets a difficult path for these patients. For women, getting a bladder cancer diagnosis is often harder than for men. They frequently need to see several doctors before their concerns are taken seriously. This is more than just frustrating for them. It actively delays the important diagnostic process. Each new appointment and repeated explanation of symptoms uses up valuable time. This time could be crucial for starting treatment if cancer is present. This cycle is very taxing for women seeking answers. Misdiagnosis is a major issue for women with suspected bladder cancer. Symptoms like needing to urinate often, urgency, or pain can be blamed on urinary tract infections. Overactive bladder or interstitial cystitis are other common misdiagnoses. These conditions are common in women, it is true, but relying on these diagnoses without fully checking for cancer is risky. This often means treatments are given for the wrong problem. The cancer can then grow undetected. Even when a doctor refers a woman to a urologist, delays continue. A urologist is a specialist in urinary tract diseases. Women often wait longer for these specialist appointments. This delay in seeing the right doctor makes the problem worse. The time from first symptom to seeing a urologist can be many weeks. It can even be months for some patients. During this wait, anxiety increases for the patient. All these issues, multiple visits, misdiagnoses, and long waits, add up. The result is that women are often diagnosed at a later cancer stage. A later stage diagnosis usually means the cancer is more advanced. It might have spread beyond the bladder. This requires more aggressive and complex treatments. This not only harms their physical health, it also takes a huge emotional toll on them. Black Americans also face serious disparities in bladder cancer care. They are frequently diagnosed when the disease is at a later stage. This is often compared to white patients. This is not usually due to different cancer biology. Instead, it points to problems within our healthcare system. A late-stage diagnosis means fewer treatment choices. It also often leads to poorer chances of recovery. We must find the reasons for these delays. Beyond later diagnosis, Black Americans may not get all needed tests. They are less likely to receive the full range of recommended treatments. This can mean delays in procedures like a cystoscopy. A cystoscopy allows doctors to look inside the bladder directly. Access to specialized urology care can also be a big hurdle. This can be due to location or insurance status. Socioeconomic factors also play a crucial role here. Several underlying factors contribute to these health disparities. A person's socioeconomic status can affect their access to good healthcare. It can also affect their ability to navigate the medical system. Implicit bias in healthcare can also be a problem. Though often unconscious, it can change how doctors view symptoms. This can affect how aggressively they investigate in Black patients. Poor communication also creates barriers to timely care. These differences show a clear need for fair care for everyone. All patients with bladder cancer symptoms need equal attention. This is true regardless of their race or their ethnicity. We must ensure Black patients get timely and thorough diagnostic tests. This means more than just following medical guidelines. It means actively fighting biases and systemic barriers. These barriers cause differences in care and patient outcomes. These diagnostic differences for women and Black Americans matter greatly. They have real effects on people's health outcomes. When bladder cancer is found early, treatment is often easier and much more likely to be successful. Patients have a better chance of a complete cure and experience a higher quality of life afterward. Delays allow the cancer to grow and potentially spread. This makes it harder to treat effectively. As a result, people who face these diagnostic delays are often sicker by the time they finally get their diagnosis. They might have more advanced cancer. This requires more intensive treatments, such as bladder removal. Chemotherapy and radiation therapy may also be needed. These treatments can have serious long-term effects. The emotional stress of a late diagnosis is also very high. How can we begin to solve these significant problems? Better training for all healthcare providers is a critical first step. This training must include raising awareness about bladder cancer and highlight how it can present differently in women. It must also address how it might be overlooked in minority groups. Medical education needs to stress checking for bladder cancer in these patients and tackle unconscious biases in care. Beyond training individuals, healthcare systems must also change. Clinics can create clear rules for checking hematuria that actively work against potential biases. Improving access to urology specialists for underserved communities is vital. Patient advocacy and education are also extremely important. This empowers people to know the symptoms and helps them insist on answers if their concerns are ignored. A combined approach will make diagnosis fairer for everyone.